Did you know that by the end of today, more than 2,000 Americans will suffer a heart attack? And the majority will be seniors over the age of 65. The most alarming truth is that many of them will not even realize what is happening until it is too late. Some will think it is heartburn. Others will believe it is fatigue. And some will even confuse it with a stroke. That hesitation, those wasted minutes, can cost precious heart muscle, independence, and life itself. I have seen seniors who survived but were left unable to walk far, unable to live without oxygen, and unable to enjoy the freedom they once took for granted. You may think that a heart attack only happens suddenly and without warning. But the truth is, your body almost always tries to send you signals. The problem is that most people ignore them. In this video, I will guide you through everything you need to know about myocardial infarction, also known as a heart attack. You will learn what it really is, how it differs from a stroke, the hidden risk factors seniors often overlook, the 7 silent warning signs you must never ignore, the dangerous complications that follow when treatment is delayed, and the proven steps you can take to protect your heart and add not only years to your life, but life to your years. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. And if not, type 0 to let me know how I can make better content for you. Now, let us begin with the most important foundation. What exactly is a heart attack and why is it so dangerous for seniors? Part 1. What a heart attack really is and why seniors are at higher risk. Your heart is an extraordinary organ. From the moment you were born, it has never stopped beating, pumping blood through nearly 60,000 miles of vessels every single day. That blood carries oxygen and nutrients to every cell of your body, keeping you alive and active. But what happens when the flow of blood to the heart itself is suddenly blocked? That is what we call a myocardial infarction, or heart attack. The heart muscle, just like any other tissue, depends on oxygen. When a blockage prevents blood from reaching part of the heart, those cells begin to die within minutes. Doctors often say time is muscle, because every minute that passes without restoring blood flow means more heart cells lost forever. To imagine this, think of your heart as the engine of a car. If fuel stops reaching the engine, the car stalls. And the longer it goes without fuel, the more damage is done. In the same way, when blood is cut off, your heart muscle weakens and may never recover its full strength. There are 2 major culprits behind this deadly event. The first is atherosclerosis, the gradual buildup of fatty plaques made of cholesterol and calcium inside the coronary arteries. Over years, these plaques harden and narrow the passage for blood. Then one day, the surface of a plaque cracks open, and the body rushes to form a clot around it, just like a scab on a wound, but inside an artery. This clot completely blocks the flow of blood. The second cause is a sudden spasm of the coronary arteries, often triggered by stress, smoking, or drug use, squeezing the arteries shut. Now, why is this especially dangerous for seniors? As we age, our arteries naturally stiffen, our metabolism slows, and decades of exposure to high blood pressure, diabetes, or cholesterol quietly damage the vessels. By the time you reach 60 or 70, your arteries may already be narrowed without you even realizing it. That means when a blockage does occur, The heart muscle is less resilient, and the complications are far more severe. Recovery is slower. Heart failure is more likely, and dangerous irregular rhythms can appear. According to the Centers for Disease Control and Prevention, more than 70% of hospitalizations for heart attacks involve people over 65. And seniors account for the majority of deaths. This is not meant to scare you, but to empower you. Because the first step in prevention is awareness. Understanding what a heart attack really is and why the risk rises with age is the foundation for protecting your future. If you think of a heart attack as something that just happens out of the blue, you will be caught off guard. But if you recognize it as the final result of years of silent changes, you will see that you have the power to act now and reduce your risk. And once you grasp the basics, the next crucial step is to uncover the hidden causes and risk factors that quietly build up in your body, setting the stage for disaster. If you are ready, let us explore those next. Part 2. The hidden causes and risk factors seniors often overlook. Heart attacks rarely appear without warning. They are the result of years, sometimes decades, of small changes happening silently inside your body. The most common and dangerous factor is high blood pressure. When blood pushes too strongly against the artery walls day after day, those walls become damaged and scarred, making it easier for cholesterol and fats to stick and form plaques. Nearly half of adults in America have high blood pressure. And among seniors, the percentage is even higher. Many live for years without realizing it. Because hypertension is a silent killer with no obvious symptoms until it is too late. Another powerful risk factor is high cholesterol. Low-density lipoprotein, the so-called bad cholesterol, lodges itself inside artery walls like rust inside a water pipe. Over time, it hardens and narrows the space for blood to flow, increasing the chance that a clot will block the vessel completely. Seniors who eat diets high in processed foods, fried meals, or sugary snacks often carry this hidden burden without knowing it. Diabetes is another major culprit. Constantly high blood sugar damages the lining of blood vessels and makes them more likely to clog. Seniors with diabetes are up to 4 times more likely to suffer a heart attack than those without it. Poorly controlled blood sugar also worsens inflammation, slows healing, and increases the chance of severe complications once a heart attack does occur. Smoking adds fuel to the fire. Every puff damages the delicate lining of arteries, making them sticky and prone to plaque. Even if you quit years ago, the scars left behind still increase your risk. And then there is obesity and physical inactivity. 2 factors that silently force your heart to work harder every single day. But beyond these well-known risks, there are hidden dangers most seniors never consider. Poor sleep. For example, studies show that sleeping less than 6 hours per night raises heart attack risk dramatically. Sleep is when your body repairs damage and lowers blood pressure. Without it, the heart never rests. Chronic stress is another overlooked enemy. Long-term stress floods your system with hormones like cortisol and adrenaline, which increase blood pressure, raise blood sugar, and promote inflammation inside the arteries. Seniors who feel lonely, anxious, or burdened often carry this invisible weight on their hearts. Medication misuse is a final but critical factor. Many older adults take multiple prescriptions for blood pressure, cholesterol, diabetes, or pain. Missing doses, stopping suddenly, or mixing drugs without guidance can trigger dangerous spikes in blood pressure or rhythm disturbances that pave the way for a heart attack. One of my patients, a 70-year-old man, forgot to refill his blood pressure medicine for 2 weeks. He felt fine at first, but one morning he collapsed with chest pain. Doctors confirmed it was a massive heart attack caused by uncontrolled hypertension. The message is clear. A heart attack does not appear out of nowhere. It is built over time by these risk factors stacking together, each one adding pressure to an already vulnerable system. High blood pressure combined with high cholesterol, diabetes plus stress, smoking plus poor sleep, all of these create a perfect storm. The hopeful truth is that every one of these risks can be lowered. By identifying them early, you can change the course of your health before disaster strikes. And now that we understand the causes, the next step is even more critical. How do you recognize when a heart attack is happening in real time? Let us move on to the early warning signs you must never ignore. Part 3. The 7 early warning signs that could save your life. Your body is wise, and it rarely suffers a heart attack without sending signals first. The tragedy is that too many seniors ignore these signals, dismiss them as indigestion, fatigue, or just part of aging. But these warnings are your chance to act before permanent damage is done. The first sign is chest pain or pressure. This is the classic symptom, but it often feels different than expected. Instead of sharp stabbing pain, it may feel like heavy pressure, squeezing or burning in the center of your chest. Some describe it as an elephant sitting on their chest. It may last more than a few minutes or come and go. If antacids or rest do not relieve it, suspect your heart. The second sign is pain spreading to the arm, neck, jaw, or back. Because of shared nerve pathways, the pain does not always stay in the chest. I once treated a 68-year-old woman who felt only jaw pain. She visited her dentist twice before realizing it was her heart. That delay nearly cost her life. If pain spreads beyond the chest, treat it as urgent. The third sign is shortness of breath. Imagine walking across the room and suddenly gasping for air as if you had just run a mile. This happens because a blocked artery weakens the pumping ability of the heart, causing fluid to build up in the lungs. Seniors with asthma or COPD often confuse this with lung trouble. But when it comes on suddenly or feels unusual, it may be cardiac. The fourth sign is cold sweats. During a heart attack, your body goes into shock, releasing stress hormones that trigger clammy sweating. If you find yourself drenched in sweat while sitting still or resting, take it seriously. The fifth sign is nausea, vomiting, or dizziness. Many people, especially women, experience stomach upset, weakness, or lightheadedness instead of chest pain. One 72-year-old patient of mine thought she had the flu until she collapsed. It was her heart all along. The sixth sign is unusual fatigue. When the heart struggles to pump, your muscles and organs are starved of oxygen, leaving you exhausted after the simplest tasks. If you suddenly feel drained, unable to do chores you managed easily before, it could be a warning. Women often experience this symptom days or even weeks before a major heart attack. The seventh sign is irregular or racing heartbeat. You may feel your heart fluttering, pounding, or skipping beats. Seniors sometimes call it a bird flapping in the chest. This can be a sign of serious rhythm disturbance caused by a heart under stress. Left untreated, it can lead to sudden collapse. To bring this together, chest pressure that does not ease, pain spreading to other areas, sudden shortness of breath, cold sweats, nausea or dizziness, unexplained fatigue, and irregular heartbeat. Any one of these could signal danger, but if two or more appear together, do not wait. Do not second guess. Call emergency services immediately. Time is muscle, and every minute counts. Recognizing these early warning signs is the first step. Next, we must look at what happens if these signs are ignored and why complications can be devastating for seniors. Part 4. The dangerous complications of ignoring a heart attack. Too many seniors delay calling for help because they hope the pain will fade or they convince themselves it is just gas or fatigue. But when a heart attack is ignored, the consequences are often permanent and sometimes fatal. The first major complication is heart failure. A heart attack starves part of the heart muscle of oxygen, and those cells begin to die within minutes. Once they are gone, they do not grow back. The scar tissue that replaces them does not pump blood effectively. Over time, the weakened muscle struggles to keep up. That is when heart failure develops. Seniors with heart failure often notice swollen ankles, breathlessness at night, and overwhelming fatigue that steals independence. I cared for a 74-year-old man who survived his second heart attack, but his heart was so weak that walking to the mailbox left him gasping. He told me, "Doctor, surviving the attack was not the hardest part. Living with this weakness is..." The second complication is dangerous arrhythmias, irregular heart rhythms that can strike after an attack. The electrical system of the heart becomes unstable when muscle cells are damaged. Sometimes it beats too slowly. Other times, it races uncontrollably. The most lethal rhythm is ventricular fibrillation, where the heart quivers instead of pumping. Without immediate treatment, it causes sudden cardiac arrest. This is why defibrillators are placed in airports, malls, and community centers. Many seniors who die suddenly do so not from the initial heart attack, but from these fatal arrhythmias. The third complication is sudden cardiac death itself. For some, the very first symptom of a heart attack is collapse, and they never reach the hospital. Statistics show about 1 in 5 heart attack victims die before medical care arrives. This is why hesitation is so dangerous. The fourth complication is damage to other organs. The heart is the pump that supplies the brain, kidneys, liver, and intestines. When the pump fails, every organ suffers. Memory problems worsen. Kidney disease progresses, and digestion becomes impaired. Seniors already dealing with chronic conditions often see them spiral out of control after a heart attack. The fifth complication is emotional and mental impact. Surviving a heart attack can leave deep psychological scars. Anxiety, depression, and fear of recurrence are common. Some seniors withdraw from activities, lose confidence in their ability to live alone, and feel like a burden on their families. A 69-year-old grandmother once told me, "Doctor, I survived, but I feel like my freedom died with that heart attack." Her words echo what many survivors feel. Ignoring the early signs of a heart attack is not just a gamble with your heart muscle. It is a gamble with your future independence, your memory, your emotional well-being, and even your life itself. The good news is that these complications can be reduced, even avoided, if action is taken quickly and prevention is embraced. That is where we turn next. What steps can you take today to protect yourself and reduce your risk before an attack ever strikes? Part 5. proven prevention strategies for seniors. The most powerful truth about heart attacks is this: the majority can be prevented, even if you are already in your 60s or 70s. Even if you live with high blood pressure or diabetes, you still hold tremendous power over your future health. Prevention is not about perfection. It is about consistent daily choices that lower risk and strengthen your heart. Let us begin with lifestyle. The first line of defense. Nutrition plays a critical role. A heart-healthy plate is not complicated. Imagine a simple meal of grilled salmon, sautéed spinach, a serving of quinoa, and a drizzle of olive oil. Each food choice fights against plaque buildup and inflammation. Omega-3, fatty acids in fish, reduce clotting and keep blood vessels flexible. Leafy greens provide antioxidants that shield arteries from damage. Whole grains stabilize blood sugar, protecting against diabetes, while olive oil supplies healthy fats that lower LDL cholesterol. Add colorful fruits like blueberries or pomegranates, and you are giving your body natural medicine every single day. This is the essence of the Mediterranean diet, consistently shown in large studies to cut heart attack risk by as much as 30%. I once advised a 70-year-old woman named Rosa to shift from fried foods and processed snacks to olive oil, nuts, vegetables, and fish. Within 6 months, not only had her cholesterol levels dropped, but her energy returned. And she told me she finally enjoyed cooking again. That is the hidden gift of nutrition. It heals and delights at the same time. Next is movement. You do not need to run marathons. You simply need to move daily. Walking 20 minutes after dinner, stretching in the morning, or dancing to your favorite music are all powerful medicine. Research shows seniors who achieve 150 minutes of moderate activity per week reduce their risk of heart disease by up to 30%. A patient of mine, Robert, age 72, began by walking to his mailbox and back. After 2 months, he was walking around the block. 6 months later, he joined his granddaughter in a local fun walk. Small steps turned into lasting strength. The key is consistency, not intensity. Now let us talk about quitting tobacco. If you smoke, stopping is the single best decision you can make. Smoking damages arteries with every puff. But here is the hopeful part. Within 1 year of quitting, heart attack risk drops by half. Within 5 years, it approaches the level of someone who never smoked. I have seen men and women in their 70s quit successfully, and the difference in their breathing, stamina, and blood pressure is remarkable. Do not underestimate this step. It is never too late. Sleep is another overlooked shield. Seniors often dismiss poor sleep as normal aging, but the truth is, 6 hours or less per night raises heart attack risk. Why? Because poor sleep increases blood pressure, disrupts hormones, and keeps the body in a constant state of stress. Aim for 7 to 8 hours. Keep your room cool and dark, and establish a bedtime routine. Something as simple as turning off screens and sipping herbal tea can transform your rest. Remember, your heart heals while you sleep. Regular checkups also matter. Monitoring your numbers gives you control. Blood pressure should ideally be under 130/80. Cholesterol should be checked at least once a year. Blood sugar must be stable, especially if you are pre-diabetic. Think of these as your body's report card. Ignoring them is like driving with no fuel gauge. You will not know you are in danger until it is too late. For some seniors, medication is an important layer of protection. Statins lower LDL cholesterol and reduce inflammation. Blood pressure medicines like ACE inhibitors or beta blockers reduce strain on the heart. Low-dose aspirin may be prescribed to prevent clots, but only under a doctor's supervision. The key is adherence. Skipping doses or mixing pills without guidance can undo all benefits. Use a pill organizer. Set reminders. And always ask questions if you are unsure. Understanding your treatment makes you an active partner in your health. Stress is the final hidden risk. Chronic stress releases hormones that strain arteries and increase inflammation. Seniors who feel lonely or anxious are particularly vulnerable. That is why social connection, prayer, meditation, and deep breathing exercises are not luxuries. They are lifelines. One of my patients, Margaret, it's found that joining a weekly walking group not only improved her fitness but eased her anxiety. Laughter, companionship, and purpose are as vital as medicine. The American Heart Association summarizes prevention with what they call life's essential 8. Eat better. Be more active. Quit smoking. Sleep well. Manage weight. Control cholesterol. Manage blood sugar. And control blood pressure. Each one is powerful alone, but together they form a shield. When seniors embrace even a few of these, the transformation can be dramatic. So prevention is not about adding strict rules or living in fear. It is about empowering yourself to live fully. Every meal, every walk, every restful night is a message to your heart. I care for you. I will protect you. And in return, your heart will carry you further than you imagined. If these steps sound overwhelming, remember this. Start with one change. Replace butter with olive oil. Take a short walk after lunch. Go to bed 30 minutes earlier. Each step builds momentum, and over time, these simple choices add up to a life of strength, freedom, and joy. Part 6. Emergency Action Plan. When a heart attack strikes, even with the best prevention, heart attacks can still happen. That is why every senior must know exactly what to do in those first critical minutes. Doctors often say time is muscle. Every minute a heart artery stays blocked, more heart cells, and once they are gone, they never come back. The faster you act, the more of your heart you can save. The first and most important step is to call 911 immediately. Do not wait to see if the pain passes. Do not tell yourself it is just indigestion or fatigue. Do not wait for your spouse or child to insist. If you feel chest pressure, shortness of breath, unexplained sweating, or any of the warning signs we discussed, call emergency services at once. Ambulances bring trained paramedics who can give oxygen, medications, and even defibrillation if your heart rhythm collapses on the way. If you drive yourself, you lose that life-saving support and risk collapsing behind the wheel. The second step is to stay calm and still. Once you have called for help, sit or lie down. Avoid moving around or trying to finish chores. Physical exertion only makes the heart work harder. Take slow, deep breaths. If you are alone, unlock your front door so paramedics can enter quickly. If you already have nitroglycerin prescribed by your doctor, take it as directed while waiting. But never experiment with medications that are not yours or that you have not been told to use in emergencies. The third step is to use aspirin wisely. Chewing one standard aspirin can help thin the blood and slow the clot that is causing the blockage. But this only applies if your doctor has previously told you it is safe. Seniors with bleeding conditions or allergies must avoid it. This is why preparing a personal emergency plan with your physician is essential. Knowing in advance what medications to take can save you precious time. Communication is the fourth step. When paramedics arrive, clearly describe what you felt, when it started, and any medications you have taken. Do not minimize symptoms. Do not say, "I am fine now," even if the pain has faded. The risk remains. Many seniors suffer silent or partial attacks that ease temporarily but still leave deadly damage behind. Consider carrying a small card in your wallet that lists your medications, allergies, and emergency contacts. I once treated a 70-year-old man who collapsed in a supermarket because he carried a card with his medical history. Paramedics gave him the right treatment immediately and saved his life. The fifth step is to remember that acting too quickly is never a mistake. No doctor will ever criticize you for calling for help too soon. But waiting too long can cost you your independence or your life. I recall a 69-year-old woman named Margaret who woke up with chest pressure at 3 in the morning. She thought it was heartburn, but remembered a health program that explained heart attack symptoms. She woke her husband, and they called 911. By the time paramedics arrived, her heart rhythm had collapsed into a fatal arrhythmia. They shocked her heart back into rhythm on the way to the hospital. The doctors later told her husband that if she had waited even 10 minutes, she might not have survived. That is the power of acting without delay. Finally, preparation before an emergency can make all the difference. Keep your phone nearby at night. Share your medical information with close family. Teach them the signs of a heart attack and practice what to do. Just as families practice fire drills, seniors and caregivers should practice health drills. If symptoms appear, everyone should know the plan. Call 911. Stay calm. Take prescribed medication and wait for professionals. A heart attack is frightening, but it does not have to be fatal. By acting quickly, you can survive and recover with less damage. The truth is that most seniors do not die instantly from a heart attack. They are given warning signs, but too many ignore them, dismiss them, or delay action. Do not let hesitation steal your future. Know the plan. Act immediately. And give your heart the chance it needs to heal. Part 7. Life after a heart attack, recovery and long-term protection. Surviving a heart attack is not the end of the story. It is the beginning of a new chapter. Many seniors believe that once they leave the hospital, life simply goes back to normal. But the truth is, your heart has been injured, and the choices you make in the days, weeks, and months that follow determine whether you live with strength and independence or face repeated setbacks. Recovery begins with cardiac rehabilitation. This is a supervised program of gentle exercise, education, and counseling designed to rebuild your strength and confidence. Too often, seniors skip rehab because they feel tired or think it is unnecessary. But studies show that seniors who complete cardiac rehab have up to 30% lower risk of another heart attack and live longer, healthier lives. In these programs, you learn how to walk safely, monitor your heart rate, and gradually regain stamina. Just as important, you gain emotional support from others who share the same journey. Medication management is the next pillar. After a heart attack, most seniors are prescribed a combination of medicines to protect the heart. These may include statins to lower cholesterol, beta blockers to ease the workload on the heart, ACE inhibitors to relax blood vessels, and blood thinners to prevent new clots. It can feel overwhelming to manage multiple pills. But skipping doses or stopping suddenly can undo all the progress made in the hospital. That is why I always tell my patients to use a pill organizer, set alarms, and never be embarrassed to ask the doctor or pharmacist to explain what each medication does. Understanding gives you control and builds trust in the process. Lifestyle change is where you take back your power. A heart attack is the body's loudest warning that old habits must be left behind. Smoking must end completely. Even one cigarette damages blood vessels and increases the chance of another attack. Diet becomes medicine. Replace fried foods and processed snacks with grilled fish, olive oil, nuts, vegetables, and whole grains. Limit salt and sugar. Drink water throughout the day. Aim for a plate full of color. Because colorful fruits and vegetables provide antioxidants that repair vessel walls. Exercise remains vital, but it should be gentle and consistent. A daily 20-minute walk, light gardening, stretching, or swimming can do wonders. The goal is not intensity, but regularity. Your heart thrives on rhythm and balance, not bursts of strain. Emotional healing is just as important as physical recovery. Many seniors feel anxious or depressed after a heart attack. They worry constantly about another episode, withdraw from social activities, and lose confidence in their independence. I once cared for a 72-year-old woman named Clara who refused to leave her house after her heart attack. She told me, "Doctor, I feel like a ticking time bomb." Through counseling, support groups, and gentle encouragement from her family, she regained her confidence. Within months, she was enjoying walks with her grandchildren again. Your mind and emotions are powerful allies in recovery. Do not neglect them. Follow-up care is the long-term safety net. Regular checkups allow doctors to adjust medications, monitor blood pressure, cholesterol, and blood sugar, and detect new problems early. Think of these visits as maintenance checks for your heart, the same way you would maintain a car engine. Skipping appointments risks silent problems building until they explode into another crisis. Prevention after a heart attack is not optional. It is essential. Finally, remember that recovery is not about restriction. It is about renewal. Seniors who embrace healthy habits after a heart attack often report feeling better than they did before the event. They sleep more soundly, move with more energy, and enjoy life with deeper gratitude. A heart attack can be a turning point. It is a second chance to honor your body and choose wisely. I tell all my patients this truth. Surviving a heart attack means your heart has asked for your attention. How you respond is your choice. You can ignore the warning and drift back into old habits. Or you can listen, change, and thrive. The heart has an amazing capacity to heal, but only if you give it the support it needs. With the right care, the right habits, and the right mindset, life after a heart attack can still be full of joy, strength, and independence. Doctor's final words. If there is one message I want you to carry from this entire guide, it is that your heart is both fragile and resilient. A heart attack may feel like the end, but in truth it can be the beginning of a wiser, stronger chapter in your life. Every warning sign, every moment of discomfort, every trip to the hospital is your body speaking clearly, telling you it needs care. The good news is you are never powerless. Whether you are 60, 70, or beyond, every healthy choice you make today builds protection for tomorrow. Quitting smoking, taking your medications as prescribed, walking a little each day, eating nourishing foods, managing stress, and getting quality sleep are not small things. They are life-changing acts that restore strength to your heart and independence to your days. I have seen seniors who thought their lives were finished after a heart attack return to gardening, dancing, traveling, and holding their grandchildren with joy. What made the difference was not luck. It was consistency, awareness, and the courage to change. So I ask you now, do not wait for another warning. Do not dismiss chest pain as indigestion or weakness as fatigue. Do not hesitate when your body speaks. Your future health is worth every call, every appointment, every mindful choice. Share what you have learned with your loved ones, because your story might save their life as well. Your body still remembers how to heal. Your heart still longs to protect you. Give it the respect it deserves, and it will give you more years of laughter, energy, and love. If this message touched you, comment 1 below. Share it with someone you care about. And remember to subscribe for more guidance. Because together, we can turn knowledge into life, and life into legacy.